Welcome everyone to this morning's forum. It really is, for me and my colleagues around the room, a really exciting day for us. This is a very diverse community out here in South West. We have 920,000 people, and the proportion of those people are from many communities across the world who I know have picked up their lives and come out here to live in Australia. But in relation to organ and tissue donation, there is lots of different ideas and understandings about organ and tissue donation, and it's one of those things, as Auntie Norma spoke about, that we just sometimes don't talk about. And yet the impact of that discussion before people pass or are passing and while they're here at the hospital is so critical in terms of giving potentially someone else life going forward. What we want to take away from today is how we can work with each of your communities. Of course, it will be different for each of you. You know your communities well, you have good relationships, good contacts. And so what we hope that we will be able to get out of today is to understand how we can get the message of organ and tissue donation out in your communities so that people start to understand the value of the program, they understand the principles of the program about how we work, and how we want to work individually with each of your communities around it. So today is about you. It's about you sharing with us how we can work with you, how we can link up with you and your communities, and what we can do to tailor our work specifically for the needs of your communities, and how we can actually build up our numbers of organ and tissue donation here in South Western. So once again, thank you for coming. I think this is the start of a great partnership with you all into the future, and I hope we will see many forums like this where we can see our organ and tissue donation program flourish and grow with all of you.
Organ donation is very rare, rarer than most people realise, and that's why conversations and forums like this are so very important. Only 1 or 2 deaths in 100 in the hospital, 1 to 2% of deaths, actually meet the criteria to be organ donors. So that's really, really rare when we think about it. So for us here at Liverpool, maybe 1 or 2 patients a month could be organ donors. And that's why working with families in the intensive care unit is so very important, because that opportunity is so very rare.
Who knows somebody who has had a transplant? Raise your hand. Quite a few of you in the room. Who knows somebody who needs a transplant? Again, a lot of you in the room. Who knows someone who was an organ donor? Very few of you in the room. Who has discussed organ donation with your family? Individuals in the room. Who has gone online and registered on the donation registry? Right, that's good. Organ failures requiring transplants are not rare. They're actually quite common. But organ donation is rare. And we do not meet the requirements of the community in terms of the demand for organs. That's why there are more people on the waiting list than there are receiving donated organs. And people, unfortunately, are dying on the waiting list. So I think what we're here today, the big thing is about that discussion.
A lot of the communities, there is this fear and lack of knowledge and lack of awareness, and worried that the body's not going to be respected afterwards. What happens behind closed doors? There's a lot of fears like that. I think today is a great start, and like you said before, what can we do forward? I think it'd be great to have a trickle-down effect, and we'd love to have you at the community centre as well. Having a forum with religious leaders, cultural leaders, to try and explain things to them, because they're someone who's really trusted people in the communities.
Organ donation staff came to Bankstown to talk to us about tissue donation. We kind of were quite, what do you mean? How can we be involved? We as a very diverse community in Bankstown understand that this is an important subject, but it's like getting the queue. We've got housing issues, employment issues, like the list goes on. Organ donation maybe sits like 8th, 9th at the list. So what we want to do is we want to make sure we can get that up the list, but also connected to other matters, particularly around what you were saying about trust with authorities, trust with councils, health, policing. There is a lot of mistrust. What we tend to do is work with our gatekeepers, our bilingual workers. They're fantastic. If we want to get news out, if we want to connect people, we go through our gatekeepers. They're the people we need to put together and then connect them to you so they can be more informed about some of the issues and concerns that you have and why people are not registering and why people are not having those discussions. They're the ones we really need to pull together, capacity build, so then they can go out to their communities and start connecting, because they do that brilliantly.
We are the first district in Australia to invest in community development, and this is just the beginning. But we need your suggestions, and that's a great one.
We could use would be an audiovisual resource.
Yes.
With some key, recognizable individuals from within these communities, because then they relate to these leaders. So if you talk, if they see my friend here's face, the Vietnamese would say, oh, look, there's a lot of trust in him. This is the first forum with community leaders, but I think, if we can have more of this, that would be welcome. I'm sure all the leaders would support that, because that is the way that, we can work with the health system to ensure that, the key message is that, we want to trickle down to the grassroots, get to the targeted communities.
I knew I was coming, so I went and asked a few people within our community, especially our religious, our Māori and Pacific religious elders, and love what you're doing with the children. And the younger generation, you talk with them, they're all for it. When I'm talking with our elders and our leaders, that's where, for me and our community, that's where our well, it's not a challenge, that's where a lot of the myth is sitting with them. So one of my religious leaders I spoke to, and he just reminded me about how our journey is, for me personally, the importance of going home, taking our loved ones home. And I was very open about, yes, I understand that, but I'm passionate about wanting to help others. And when you mentioned that some people are announcing that at funerals, I've been at a funeral where that was announced, and I saw the reaction from people, and you're right, I think it's wonderful. I mean, not saying, well, yeah, that's an opportunity, but to be able to share what their loved one did by donating their organs. As I even drove here, my husband and I we've spoken about it, and we've spoken to our children about it, and we were talking again as he dropped me off. I think, how do we, I think what's been shared is great. I've been looking at the slide there, and I'm thinking, yep, be great, get the multicultural leaders or those faces in your campaigns, so that our communities are recognising, oh well, there's auntie or there's uncle or there's the chairperson of so and so, and help, and that way we can help.
Some videos around the process.
Yes.
That also identify yourselves as leaders in the community who said, I've been to here, I've learned that, it's actually quite different to what I thought it was. Here's the process.
That's correct.
Draws people in. So not only the pages, but perhaps some videos or whatever that we can actually get out around the community might even support that process.
And also to use social media.
Yes.
Everybody's getting into social media, so if that could also be incorporated. Twitter, Facebook, Instagram.
But what we would like you to consider is some signature that you will partner with us to help spread the message, and that we will work with you. It's purely just to say that we've joined in the conversation and we want to work together as a group to improve the health of our local communities.
Today has been so rich, seriously. Your comments, your feedback, your interaction, no trouble kind of, throwing the questions out there. It's been fantastic. But what you've given us is so many different ways and strategies we can now work with you on. So on behalf of the team and the organ and tissue donation team, thank you for your time and your commitment today, because I think you've seen how rich and wonderful that it's been. It really has. I just want to thank you for your contribution. You have been fantastic today. So I look forward to ongoing contact, and trust that you'll think about signing our statement of intent as you go. So thanks so much.
It has been really wonderful to be able to attend the South Western Sydney Local Health District Community Leaders Forum today. I'm really grateful for the huge amount of work and for the success in engaging this really diverse and vibrant multicultural community out in South Western Sydney. We really look forward to working with you all more in the future.